So first off, how do you identify a bowed tendon? Looking at this tendon, this is a normal tendon. It's not puffy, it's not larger, it's not bending out in any way. It's just kind of straight with the fetlock. Now come around, you've got your bowed tendon. This one's already been getting treated for a little while, but you see how much puffier it is all the way around. Like, that's a nice puffy tendon. And you can see how it kind of puffs out. That is what a bowed tendon is going to look like. Sometimes they're even more severe. They puff out further. This one did. Some of them are not as severe. For starters, you don't want to do any of what I'm about to tell you unless the heat is gone. If there's still heat in this leg, you do not want to sweat it. You could wrap it, but you don't want to agitate it in any way. But we're at the point where there's no longer heat in this bowed tendon, so we are starting to sweat it. So I'm going to show you the different options with wrapping that you can do when dealing with the bowed tendon. So with the bowed tendon, you first off would want to get something to like agitate it essentially. Some people blister it, some people will use like Thermoflex, some use Furisone. I'm using what's called ball solution. Now this stuff you would want to use like a toothbrush to apply it, because it will stain your hands, but we just put some ball solution onto the toothbrush and rub it down that tendon. That will help agitate it essentially and bring blood flow to the area. I usually do 2 to 3 swipes of it. Get this other side real good. You want to get it plenty on there. It's going to dye the fur an orangey red color. It's like an iodine. Now, once that's done, you can do just a no-bow wrap with a standing wrap, or you can sweat it. I do a direct sweat on her, so that means they're just going to take the saran wrap and wrap it around the leg. Try to keep all the lumps and bumps out because you don't want to cord that tendon. So wrap it just 2 to 3 wraps around. Nothing extravagant. That doesn't hurt by any means, but we're just going to do a couple wraps, break it, done. She of course wants to move her leg off the mat. There we go. Once that's done, you take your no bow and you wrap that. I always go with the inward with pressure. No bow helps to prevent a bowed tendon or a corded tendon. Make sure there's no lumps and bumps, and then you take your standing wrap and you wrap that. I start at the top. I never pull tight at the back of it. I always pull tight at the front to help reduce any risk of bow or cording of that tendon. Now, instead of direct sweat, you can do an indirect sweat, which would mean I would have taken that saran wrap and wrapped it around the no bow before putting the standing wrap on. So you can do the direct sweat or an indirect. Just apply even pressure all the way. Once you get down to the bottom, start going back up. And you would typically always want to change a wrap daily, just to reduce any risk of it loosening and causing any type of cording of that tendon. So you would want to do a daily wrap change. But that's all you would do, and you just keep on applying those wraps until it is healed. She's still lame on it, it still hurts, it's still healing. So that's how you deal with wrapping of a bowed tendon.